Hi, Alexia. My name is Angela, and I will be your nurse on today. Okay, Alexia, on today I will be performing an assessment of your renal, abdomen, your neurological, as well as musculoskeletal. Okay? Okay, Alexia, should you feel any form of discomfort, please let me know and I will stop the assessment, okay? Okay, so first I'm going to ask you, are you feeling any form of discomfort at this time?
No.
Okay, first we'll start off with your abdomen, okay? If you can please lie down for me. Okay. And what I'm doing is I'm just inspecting your abdomen, okay? It is flat. Your respiratory movement is equal and even. Okay, your umbilicus is inverted. Okay, your skin is smooth. No lesions, nodules, or masses. I also see a pulsation as well as a peristaltic movement. Okay. Next, what I'm going to do is I'm going to be listening to your bowel sounds. Your bowel sounds are active in all quadrants. Okay, now what I'm going to be doing is listening to your vascular sounds. Your aortic, your renal, your iliac, and the femoral. Okay, so what I'm going to be doing now is I'm actually going to be percussing your abdominal area, okay? And I'm just listening for this sound. See if there's any fluid in there, in your abdominal area. Do you feel any discomfort?
No.
Any discomfort? Okay. Now what I'm going to be doing, Alexia, is I'm going to actually be palpating your areas, okay? And what I'm going to be doing is I'm going to actually be doing light palpation as well as deep palpation. I'm also going to be palpating your liver, your kidneys, your aortic area, your femoral area, and your inguinal areas as well, okay? So first I'm going to start off by light palpations, okay? And just let me know if you feel any tenderness. Any tenderness?
No.
Okay. Now I'm going to go deep. Any tenderness? Okay, now I'm going to actually be palpating for your liver, okay? Okay. See her? Okay. Your kidneys. Spleen. Aorta. Inguinal lymph nodes. Okay. Now what I'm also doing is I'm palpating for your appendix. Okay? So what I'm going to do right now is I'm going to just ask for you to flex your right foot. Do you feel any pain in your right quadrant?
No.
And that's this area here. Okay. All right. Very good, Alexia. Okay, so now what I'm going to do is I'm going to actually ask that you would actually turn. Okay. And now what I'm going to be doing right now, Alexia, is I'm actually going to be checking for your muscle. I'm going to be performing on your muscle skeletal, okay? So now we're going to be checking your lower extremities, okay? So now what I would like for you to do is, as far as your extending your lower extremities out for me. Okay, and they are symmetrical and they're equal. Okay. Now what I would like for you to do is I'm checking your muscle strength. So if you can sit back a little for me. Sit back. Okay, and if you can actually push. Okay, you have a strong push. Okay. Now if you can come forward. And I would like for you to do range of motion. And range of motion is you're just moving your legs, your lower extremities in a circular motion, okay? So if you can perform with your lower leg. This leg here. Does it hurt? Okay, and do the other one. Okay, any hurt? Does it hurt?
No.
Okay, now we're going to move to your upper extremities, okay? And I'll be checking your range of motion there as well. Okay, what I would like for you to do is your shoulders, the range of motion with your shoulders. Okay, and backward. Does it hurt? Okay, and your arms. If you could extend your arms out for me and perform range of motion. Okay, very good. And it's symmetrical. Okay, now what I would like to do is I would like to check your hand grasp. If you can actually, I'm checking your muscle strength. If you could squeeze my hands for me. Okay, you have an equal and strong hand grasp. Okay, thank you. Okay, Alexia, so now what we're going to be doing is we're going to be moving right along with your assessment. Now we're going to actually be checking for your, neurological assessment, okay? So what I'm going to be doing now is I'm going to be checking for your Romberg sign. Okay, so what I would need you to do is actually stand up for me. Okay, if you can face this way. Okay, I need you to close your eyes, put your hand to your side. Okay, and just close your eyes, and I'm just checking to see if you have a sway. Okay, and there's no sway, which that's a good sign. Okay, if you can sit down for me, Alexia. Okay, so now what I'm going to be doing now, Alexia, is I'm actually going to be checking for your patella. Okay, the reflexes, and that's in your knee right here, okay? Okay, if you can just sit all the way back, and I just want your legs to come a little further for me. And just let them flex a little, okay? Just come a little further, okay? All right. Okay, you have a good patella reflex. Okay, so now what I'm going to be checking for, Alexia, is if you can stand up for me, I'm going to be checking a scoliosis screening, okay? Okay, so if you can turn this way, okay? And I'm just checking to make sure that your spine is actually, it's midline. Okay, and there's no curvatures, okay? So if you could please, I'm looking at your scapulas, okay? So your scapula is symmetrical, as well as the iliac crest is symmetrical horizontally. Okay, if you can lean forward for me. And then, yes. Okay, and your vertebrae and your spine is actually midline, okay? And if you can stand up for me. Okay, now you can sit back down. Okay, what I did forget to do, Alexia, is I did forget to check your pulses when I was actually checking your lower extremity. So what I'm going to do now is I'm going to ask that you would, I'm checking your lower extremity pulses. So right now I'm going to be checking your post-tibular pulses. Okay, and they are palpable. I'm sorry. This is your popliteal pulses. I'm sorry. This is your post-tibular pulses I'm checking. And your dorsal pedius. Okay, and they are palpable. Okay, Alexia. At this time, this concludes our assessment of your abdomen, your renal, your neurological, and your musculoskeletal. Did you feel any form of discomfort?
No.
Any tenderness?
No.
Okay. Do you have any questions for me?
No.
Okay. Thank you so much, Alexia. Okay. And at this time, I will report off to my nurse that I did perform an assessment on Alexia of the neurological, musculoskeletal, abdomen, as well as the renal. I did not find any abnormal findings. Should I have found any abnormal findings, I would have actually performed a focus assessment. Thank you.